Hi, everybody. Good afternoon. This is Kathy Robinson. I'm the director for BEADS. I want to just thank everyone for joining us this afternoon for our BEADS Provider and Case Manager monthly webinar. We have several agenda items today and a special guest, so we will jump right in. But before we get started, I do want to just give some logistical information for folks to get oriented to Microsoft Live if you haven't used this format before. And for those of you who are regulars, just follow along with us. We are just sharing some information about how to use live captions. You can turn on live captions and subtitles by selecting the captions and subtitles option in your video controls, and you can change the caption language by selecting settings and then caption subtitles and then choosing the language that you want from there. So if you need that option, here's just some general basics on how to navigate and get to that in your controls. And then we're assuming that you may have questions today, and so please know if you need to ask questions, you may do that by selecting the Q&A on the right side of the screen. You can type your question into the compose box and make sure that you select send so that it makes its way to us as presenters so we can see those questions and comments. Your questions will only be available and visible to us as presenters, and we will try to cover those today as time permits, but please know that we do look at those, and if time allows, we do try to answer those at the end of the presentation. We also want to make sure that you are able to sign in today. The Q&A box or the chat on the right side under the featured list, there's a link for the sign-in sheet. Clicking the link, you can complete the form and then submit that to us. That allows or ensures that certificate of attendance that you'll get that and have the title and date of today's meeting with an electronic signature. So just be sure we'll remind you friendly nudges throughout the presentation to sign in, but we want to make sure that we have record of your attendance with us today. So with that, I just want to touch on quickly what we'll be discussing and covering today during our time. We are going to just do a run through. I'm going to share the most recent COVID data that we have for BEADS. And then we have a special guest with us today, Dr. Maria Fanel, who is the FSSA Chief Medical Officer, has a lot of good information to share as it relates to COVID as we are getting into November and soon, the full throes of kind of the holiday season. And so we wanted to revisit some of the COVID, general COVID information and kind of some of the data of what we're seeing. We feel like that might provide a good context for folks as you guys are thinking ahead and doing your own planning, both personally and for service provision consideration purposes. I'm going to just provide some general updates and affirmations, I guess, related to the public health emergency and where we are with that. And an update related to the case management innovation project that we're currently working through, and just touching on a preview of information related to provider claims resubmissions related to the 14% increases that were implemented this year. So we'll touch on that as well. So hopefully you've all gotten familiarized with this image and our goals for COVID-19. We are continuing to use this as a foundation and backdrop, I guess, as how we are navigating COVID and how we are implementing flexibilities, ensuring that folks can continue to get their support needs met while we're also supporting our provider network in delivering the needed supports and services to individuals in our services. So just a reminder that this is what we've been using to kind of lead us through the pandemic. And with that, I'll give us some updates on our most recent COVID data. So the data we're going to share today is as of November 1st. So this is, I know we're at the 3rd, so this is from a couple of days ago. We have the total number of cases here. This is broken down again by waiver and by our supervised group living ICF settings. So we have total number of cases, 3,928, and that is since the beginning of us measuring this data at the start of the pandemic. And the total COVID-related deaths are at 96. That is an increase. 96 is an increase of 6 since October 18th. So then in looking at this same data as of November 1st, you can see the total number of cases, that 3,928, broken down by age and where the funding source, or the CIH, FSW, and SGL. And you can again see sort of where the uptick in some of those cases have been. I would point to, as we continue to see that 0 to 19 age group on the family support waiver continues to be where we see that expansion of cases or increase of cases. For the CIH, again, 1,688, family support waiver 1,363, and SGL the 943. So then in looking at the total COVID positive cases by county, so that is our data reflected in this map, so you can kind of see where those concentration of cases are falling throughout the state. It's the same data as of November 1st, so we're looking at that same number, the 3,928, and you can see where those the darker counties obviously represent the higher concentration of cases throughout the state, and it continues to largely reflect same focal areas or concentration areas as we covered from October, and you can see the breakdown of what that looks like across the state. So looking now at total number of staff COVID positive cases, so this is those staff who are in being reported, who are providing supports in those congregate residential settings. The total positive staff cases is 2,477. That's an increase of about 46 since the October 18th timeframe. And then we still have COVID-related deaths for staff are at 7. That's remained unchanged since October. And that breakdown is, again, as you can see here, 1,726 total staff COVID positive cases on the waiver side, and 751 in our SGL or group home settings. And then again, you can see we've done a map similar to the individual positive cases. This is COVID positive staff cases by county. And you can see that breakdown here again, where the concentration of COVID positive cases are for staff. Again, this is staff reported per the State Department of Health order for direct care staff working in those congregate settings. So same numbers here is just reflective of the darker counties reflecting those higher concentration of cases. So I just want to remind folks, we did have some new attendees join since we started just a little bit ago. So if you haven't signed in for today's meeting, there's an opportunity for you to do that, and directions on how to do that here, just using the Q&A box and finding the link and clicking that link so that you can complete the form and submit it so that you can get a certificate of attendance for today. If you haven't done that, please be sure that you do that before the end of today's presentation. So I really am excited that Dr. Fanel is with us today to provide some updates and information. As I mentioned earlier, Dr. Fanel is the Chief Medical Officer for FSSA. She is a friend of DDRS and has been a really great support to us in her work within FSSA as we have navigated the pandemic, but also other, as she will probably attest to, random medical questions that we have for the individuals that we support, and helping us navigate some of those challenges and issues as well. So I really am very appreciative of her time. And with that, I will hand it over to her to give you some, I think, really helpful and relevant information related to COVID-19 this afternoon.
Great. Thank you so much, Kathy. Hi, everybody. We can do the next slide, please. So good to be here. One brief slide, just so that you know who you have in front of you. Not a long essay on this at all. So my name is Maria Fanel. I'm a pediatrician, is my background, and my training came from the IU system. I worked at Riley, still work at Riley in the NICU follow-up clinic 1 day a week, actually. And then I have some training in the past as a health services researcher, and I have worked for one of our managed care entities before coming to the state. And I have been here a couple of years now and sort of had the pleasure of being here for the whole time during the PhD to date, which has been, as you all know, quite the time for all of us. So I was hoping today to talk to you a little bit, sort of give you an update on COVID-19 and hopefully address some quite common questions. Kathy already sort of talked to you about the numbers for your community and so forth, but I'll talk a little bit, just a few slides on COVID-19 in Indiana, where we're heading. And then I actually decided to turn this into more of a Q&A sort of session. So because I have been asked to do this type of talk for several different types of providers, I have learned now there's certain questions that come over and over again, both from providers, but also from the people we serve. So I'm hoping to be able to address those and just talk through them. If there are additional questions you have, certainly I do think, if I understood it right, that there's a way to sort of get those through in the chat as well. So I can't guarantee you that I'm going to address everything that people want to know, but hopefully many of the questions. So it's not going to be a lot of slides. It's going to be a lot of me talking, and hopefully in a way that's meaningful for all of you. Next slide, please. So COVID-19 in Indiana, just sort of big picture, I think it's important to know it appears that we have seen the worst of what we have called the Delta wave, this new variant of the virus. And the cases have actually decreased now for the last 8 to 9 weeks or so. So that's important to know. That means that our hospitalizations are also decreasing across the state. What I will show here in the next slide is that we have certainly seen that unvaccinated individuals have been way overrepresented among those hospitalized during this wave. So that was the difference, obviously, now when we have the vaccine versus previous waves in this pandemic and what we have seen. I just wanted you to sort of pitch a little bit for the Department of Health website here, where there is actually great information about the pandemic in Indiana and a very data-driven approach. So should you have an interest of looking up for how it looks exactly where you live, or how the hospitalizations or deaths or cases are trending, that's open to the public and certainly to you as well. So that's the link that you see there. Next slide, please. So this slide provided from the Department of Health, it's now a few weeks old, but it's not, this is the trend we're seeing. Essentially, as you see, this captures sort of last winter when we peaked in January with the hospitalizations. It shows our little less of a wave or peak in hospitalizations in the late spring, and then how we were doing better over the summer. But then unfortunately the virus changed, and it shows the hospitalizations that we had to deal with during this fall. That has been quite brutal, actually, for a decent amount of hospitals and sort of systems caring for individuals. What the orange line shows is the people who have been vaccinated, fully vaccinated, meaning they have been either had 1 shot of the Johnson & Johnson or 2 shots of the Moderna or Pfizer. And the blue are those people that have been not vaccinated. So there's been an enormous difference this fall in hospitalization depending on vaccination status. The steep decrease that you see there, that's not quite true. It is coming down, but that's a data lag issue. So it looks like it's sort of going straight down there. But there's been this consistent big difference between hospitalized and between vaccinated and non-vaccinated individuals during this Delta wave. Next slide, please. And then the other thing that I think is sort of important to see that has been different this Delta wave during the fall of 2021 compared to previously. You see that sort of reddish line, or maybe it's orange, but the one that's on top anyway has been like the younger individuals, our 0 to 19 age group of Hoosiers that have had so many more tests and so many more positive cases during the Delta wave than they ever had previously, actually. And some of you may have experienced that with either your own children or people you cared for when school started, and there was a lot of quite difficult actually to get tests and get tests back for children who needed so many. And the difference this time around with the Delta wave turns out that we got many more children affected, and the virus just has been more contagious, going from one person to another person much faster. So that certainly affected the children as well. So next slide, please. So then I want to talk about a few different, and I sort of divided these questions in categories. They're not absolute at all, but I thought these were good things for you to be updated on and be aware of. So, and then we'll take additional questions. So the general questions regarding COVID-19. Somebody asked, how do you know which COVID you have, Delta or original? Well, the truth is that right now you have Delta. The official state statistics is something like 99.4, 99.6% or something like that of current COVID cases in Indiana is the Delta variant. That's how much that dominates among COVID cases. And the next question, why does it matter if you stay home if you're sick? Somebody asked that, and it does matter because sort of trying to prevent people from spreading the disease. Sometimes we know if somebody has COVID, but we don't always know. But we know that people are the most contagious when they're the most symptomatic in that first sort of 7 days of their illness. So we want to make sure to stay home when you're sick is like really good public health measure to avoid spreading the disease further. And then people have often asked during this fall, why did the mask mandate change? Why did it change from that you were fine to not have a mask when you're vaccinated and suddenly you needed the mask again? The answer to that is that the virus changed. So what we initially, when we didn't have the vaccine, the measures we had was good hand washing, keeping the distance, and wearing a mask. That was it was better than nothing, but it wasn't perfect. It wasn't enough. And then we got the vaccines, and initially that turned out to be really, really effective. The vaccine, not only did they prevent hospitalization and death, but it also prevented a lot of people from getting infected. And it still is very effective that way. But what turned out with this Delta wave is that the virus changed enough so that we learned that even vaccinated people could, for example, to much less degree than unvaccinated people, but they could still actually have the virus, sometimes without knowing it, and they had some chance of spreading it to others. And because this virus, the Delta variant, was so much more contagious, we had to add sort of the recommendation about masks, and especially masks indoors, back into the toolbox of how to stop this pandemic, and that's really what's changed. And a lot of people have been quite frustrated by that, and it's understandable, right? People thought the vaccine was going to be the answer to it all, and then it wasn't quite. And then people often ask about testing for current COVID-19 infection. What test? When should you get tested, and what are the types of testing? So people should still get tested if they have symptoms. That's still an important part of sort of stopping the spread of this pandemic. There are two different types of tests for active COVID. One is called the PCR test, and that I would call that's probably more the gold standard. That's the type of test that you get, and then it's sent off into a lab, and then it takes a while before the results come back. they have better this technique tremendously. So now you can actually get it back quite fast, but you don't get it right at the point of care. And then the other type of test for active infection is called an antigen test, or like a rapid test. They're set up a little different way. The COVID, the PCR test is the one that it tests for virus, genetic material of the virus. Super sensitive. It's so sensitive, so the PCR test, you can actually get positive even like after you have had you have recovered from the illness. You can still test positive PCR. Antigen tests for pieces of the virus in a different way and are not quite as good as picking it up. But if you have a positive antigen test, you should rely on it. It turns out that the antigen test, that type of test that you can get back right away, which is also the types that they sell for home use, is not so. It's not as good to picking up people who have asymptomatic infection, meaning they have COVID but they don't have any symptoms. So those are the two tests for active infections. And then people often ask about, what about that antibody test? We heard a lot about it. Where does that play a role in all that? The antibody test is a test to look for whether somebody has developed antibodies to the disease, and it really is a test that tells you what happened in the past. So it can help tell us if somebody has had COVID. However, it doesn't necessarily tell us when exactly they had it, and it certainly doesn't tell us exactly how well protected they are just because of the antibody test. So for a while, you may remember now, around a year ago or so, we had put a lot of hopes to the antibody test. That's how we were going to sort people, whether they can do one thing or another, whether they had antibodies for COVID. And that turned out to be not the case so much. It still plays a role for us, but it's really not the testing we're talking about primarily right these days. It's really that PCR test, the gold standard, or the antigen test, the rapid test. Next slide, please. And then a whole lot of general vaccine questions. I think these are important to talk through. People continue to have questions about this vaccine, and this sort of world of information we have gotten over the last year have been such a enormous amount of information that we have asked people to consume and sort of make decisions based on. So I'm going to address some of them here. So first one, can you give a little history and explanation of the new vaccine and technology with messenger RNA vaccines? It feels like it came on really quickly, so it feels new and scary. So in general, all vaccines work that in the way that you inject a little bit of either a live, in the past, either a live virus or a live, something that's not live anymore, but sort of that the body sees and react, and you just give enough that it's not dangerous to the person, but enough for them to get an immune response. That's in general how vaccines have worked, and we have certainly had them around for a long time. The messenger RNA technique is a new technique to develop vaccines, but it's not brand new. It's not as new as people sort of maybe feel like it seems like it has been over this last 2 years. It really is something that has been developed and worked on for several decades at this point, and scientists have had really high hopes for this vaccine techniques to be something that can sort of be much more precise and better for us when it comes to vaccine techniques than the previous old techniques have been. And because of the funding available for COVID-19 vaccine, this turned out to be the time where we actually could the scientific community could make that next leap and sort of put these into practice. So mRNA vaccines works the way that a little bit of this mRNA is injected, and your own body actually produces a little bit of the protein that's needed for the body to mount an immune response. But it's not, and then it goes away. So whatever is injected goes away and is no longer in your body. It is not saved in your body. It is certainly not something that changes your DNA or how your genetic profile looks. As many of the sort of misinformation about the mRNA techniques have conveyed, it is not like that at all. It's actually just really a very precise, I would say, method for the body to get for a protein developed that the body can respond to, so that it can have a good immune response against the virus. in a much more precise way than what we could with our previous vaccine techniques. So what are the differences then between the three vaccines, Pfizer, Moderna, and the Johnson & Johnson? The primarily is that the Pfizer and Moderna are developed with a new technique, or newer to us, the mRNA technique, and Johnson & Johnson is sort of the older type of vaccine technique. And then, of course, in addition to that, it's important to know that Pfizer and Moderna has required 2 additional doses, or like first doses, in order to be considered vaccinated, and Johnson & Johnson was 1 shot. And then, of course, now we know that the cards have changed a little bit because the boosters are needed, and I'll talk a little bit more about that later. So why should you get vaccinated and vaccinated people are still getting COVID? So I hope that previous slide that I showed a few slides ago, that's showing the difference between vaccinated people and unvaccinated people, sort of spoke to this. Essentially, we know that yes, you can still get COVID if you're vaccinated, but your risk of getting COVID is so much less. I mean, tremendously much less than it is compared to if you're unvaccinated. Even more importantly, though, the biggest effect is even if you're vaccinated and sort of get COVID, for the most part, that infection is milder and it doesn't put you in the hospital or dying. It's not 100% true. We have still seen some really vulnerable individuals, people, for example, that have had maybe other diseases going on, or cancer, or some other reasons why their immune system their vaccination hasn't protected them as well, or if they've been really elderly people in general tend to response not quite as good to vaccines. So some people we have certainly had some vaccinated people being hospitalized and dying, but their numbers are far less, not even comparable to people who are unvaccinated. So it's still a very good idea. While no vaccine is 100%, no vaccine in the past has ever been 100% either protected, getting the COVID vaccine is a very good idea if you're interested in being protected against the disease. The next question, how long does the natural immunity last if you have had COVID? That's a great question. Natural immunity taken as sort of if you have the infection, how long are you protected? And the answer to that is a frustrating, it depends. So it turns out that people that have really severe disease, maybe disease that put them in the hospital and put them in the ICU, had got a stronger immune response and their protection lasts longer than somebody who maybe had just a very mild case, maybe had more like cold symptoms. Exactly how long it lasts, however, for different individuals, we can't actually say. We can't say it's exactly this long or it's exactly that long, depending. So if you have natural immunity, the duration depends. We have counted on probably that everybody's probably at least reasonably protected for at least 3 months, but it's probably longer for some people, frankly, with natural immunity as well. And then the question following that, should you get the vaccine if you had COVID? This is like maybe one of the most common questions I get from the parents in my clinic. It's not uncommon for people to say, well, I had COVID and it wasn't that horrible, and I wonder if I should get the vaccine. And the answer is yes, you should. And the reason that is that we now know, which we didn't before, that the protection from the shots are much more, it's much more stable and even for different people, and it's much more sort of, if you get the vaccines, your risk when you are exposed to COVID the next time around, it's much less than if you had the infection and gets a different version of the virus later on. It turns out that the risk of sort of being hospitalized are less if you have had the shots versus if you had, quote, unquote, the natural immunity. Not that the natural immunity is not good at all, but it's not as good as the vaccine. So the recommendation is definitely to still get the COVID vaccine. And then this is a great question, I think. Is there a difference between immune response and side effect? So often, actually, we think of the good immune response that almost everybody gets from this vaccine, maybe a little bit of arm pain or some swelling or some mild feeling of not feeling great the next day or so. Those are all, they are the immune response, but it's also counted as the side effects, of course, because there are. I mean, you wouldn't have gotten these symptoms if you didn't have the vaccine. Saying that, there's also some other side effects that are much more severe than that are not very common at all, but does happen. So as many of you may have remembered that when you got the shots, you had to wait 15 minutes, and that's sort of to make sure that people don't get an allergic reaction to the vaccine. So that's why we keep people 15 minutes to wait after they get the vaccine. So that's one recommendation. That's a side effect that's severe. There's also some other side effects that have been seen with some of the vaccines. Some of you may have heard about Johnson & Johnson and the very rare side effect of coagulation problem or blood clotting problems in younger women that got those vaccines. Very rare, but again, a side effect that we would never have probably known about if it wouldn't have been that these vaccines have been given to so many people, so we could have really studied. So we know much more about these vaccines that maybe we really ever know about many of the other vaccines, or at least not until several years with the other vaccines, versus now we sort of got this information pretty quickly. So immune response is normal, not unexpected to get, but also counted as a side effect. And then there's these rare side effects that we see when we give a vaccine to so many people. Not commonly happening though. How long does the vaccine protect you? Great question. We don't know is the answer. We're still counting. What we have seen on, and you will say, hey, what do you mean by that? We have the boosters now. So what we have seen is that in certain, we have seen that the vaccine effect sort of goes down over time, over multiple months, and we saw that it particularly went down in elderly people. So the vaccine recommendation, booster recommendation now is for sure that everybody over 65 should get it, and everybody that got a Johnson & Johnson shot, that one shot, should also get a booster. But then many others, essentially the doors are open for everybody else to get a booster as well. So the vaccine protection from 2 shots definitely went down over time. What we don't know is when people get the 3 shots, meaning like they get the 2 plus the booster, we don't know yet how long that's going to protect people. We don't know yet if this is going to be a vaccine like maybe the flu that we're going to need on a yearly basis, or maybe every other year, or if it's going to be something that we don't need as often. And that is something that the sort of scientists are following right now and trying to measure and figuring out, because obviously we want people to not needing vaccines more often than absolutely needed, but we also want people to be well protected. Next question, do unvaccinated people pose a risk to those that are vaccinated? And the answer is a little bit. You're a much better case if you're vaccinated than if you're unvaccinated, but no vaccines, and that's true for all vaccines over time, is 100%. So if you have a lot of unvaccinated people around you, even if you're vaccinated and they happen to have COVID, there could be a lot of virus around you, and you're not 100% protected for that. So there's some risk, but the unvaccinated people pose a much higher risk to other unvaccinated people than they do to those that are vaccinated. Next slide, please. So booster questions. What about the booster? How is that different than the third shot some are getting? And now it's really third shot or the booster. So this has been difficult to message, I think, in general. The third shot was really for those people that didn't quite actually get enough of an immune response to 2 shots. So think of people with a weaker immune system for one reason or another, or a weaker immune response. So people with maybe receiving cancer therapy, or people that are on certain type of medication that sort of put a brake on their immune system. That's what the third shot was. They essentially needed 3 shots before they had a decent immune response. For the booster, it's a little bit more. It turns out that most people had a really good response to the 2 shots for the Moderna or Pfizer, or 1 shot of the Johnson & Johnson. But over time, that response went down, and they needed a booster, like a little bit of a vaccine, to sort of get up to that high protection level again. And why does data change, and is it common, or should this scare us? This is a question around why we didn't think we needed booster, and now we need boosters. I actually would say that the fact that data is changing and that we're learning more about this virus and the protection from the vaccine is a fabulous thing, and we should all be grateful, and we should not be happy if people come out and say 100% that they know the answer from how it's going to look 6 months from now or a year from now. So I would embrace, as frustrating as it is that the data is changing and that recommendations change, try to see this as something to embrace and be happy that we're learning more about this virus. So hopefully a few years from now, we're not in the place we are now. We know even more, and maybe we know how often we need to get the shot, for example, to be protected. Next slide, please. Lots of questions out there about COVID-19 vaccine and fertility. I have two teenage daughters. I have a younger daughter as well, but they have both independently come home to me and asked me about fertility questions around COVID-19 vaccine. And I think they do that because they talk about this in school. So first question, what is the vaccine impact on fertility for men and women? So what we do know, one is it has been studied. They have, for example, looked at women. They have looked at women who really wanted to become pregnant, and they have looked at women who either had neither the disease or the vaccine, and then they looked at people who had the shots, the full shots, the 2 Moderna or 2 Pfizer or 1 Johnson & Johnson, and they looked a third group at women who had the COVID-19 disease. And then they followed them over time and looked at their ability to get pregnant, and it turns out that there was no difference. So by that, it doesn't appear that sort of having that vaccine or disease, for that matter, affected fertility for women. For men, it has been even more sort of scientifically studied. They actually looked specifically at sperm counts and looked at that for people who had the vaccination, the disease, and not had the vaccination. And then they looked at whether the sperm count for men changed, and it didn't affect that. So those are important pieces of information. So the doctor and scientific community, we sort of don't expect fertility to be affected at all. We also, I think it's really important to make this plug too. We don't have a history of in the past that vaccines affect fertility. That's sort of not something we are particularly worried about when it comes to vaccine, and so not for the COVID vaccine either. We do have a history of infections, certain infections affecting fertility quite a lot, actually, but not the vaccines for those infections have not. So I think that's important to know as a backdrop as well. And then lots of questions about what about pregnant women and the vaccine or COVID? And this has been confusing, right? Because initially, when we didn't know as much about the vaccine, there was a recommendation, or at least it was an unknown whether the vaccine was helpful for pregnant women. And we have learned since that it's a strong recommendation for pregnant women to get the COVID-19 vaccine. And the reason is that COVID-19 is such a risk for pregnant women. They have worse outcomes from the disease itself. They get sicker, get hospitalized much more often. In addition to that, they have a risk of giving birth to a child earlier than sort of giving premature birth, and babies being born early. And most of us know that if a baby is born too early, that's a risk for the baby itself. So NICU stays, long hospitalizations, difficulty maybe feeding, difficulty keeping the temperature, difficulty growing, and so forth. So with the recommendation now is very strong and absolute that pregnant women really should get the COVID vaccine, and that is better for both the mom and the baby. Next slide, please. And then the COVID-19 vaccine in children. This is a hot topic right now because the recommendation just came out that COVID-19 vaccine is also recommended for the age group now that was rolled out is children aged 5 to 11. So not the very youngest yet, but younger than the previous recommendation was down to age 12. So the dose for the COVID vaccine for children younger than 12 or the 5 to 11 is a third of the adult dose. So it's less vaccine in the vaccine, so to speak. The needle is also smaller for children. And it's the Pfizer vaccine. It's only one of the 3 that is currently approved for children. And then the question is, so why should children be, why is this recommendation? Most of us have sort of grasped at this point that children are not the group of people that have been hit the hardest by the COVID-19 as far as disease severity and deaths. Saying that, though, that we have not, children are not unaffected by this disease. If anybody thinks sort of that's the case, that is not correct. We have had, I believe it's 12 deaths in Indiana in children in COVID. Nothing compared to sort of the number of adults, but still a number that is scary for all of us to think about, that there are children that have died in the state from this disease. In addition to that, there are a decent amount of children who has needed hospitalization, especially this Delta variant that came this fall, that needed to stay in the hospital and get help with breathing and so forth. But then there's two other things that also happens to children, and one is that some children get these long lingering symptoms, just like some adults get from COVID, which can obviously very much affect their activity and what they're able to do and so forth and so on. And sort of this long COVID syndrome that we talk about sometimes both in adults and children, that happens to children too. And then there's another a little bit more unique to children, multi-inflammatory syndrome in children, MIS-C, you may have heard of. That is essentially that those children may have a very mild COVID. Doesn't necessarily mean that they've had any severe COVID, but in the weeks thereafter, their immune system react and create a cascade of inflammatory changes in the body, so that they get fever and pain and swelling, and other organs are affected. And almost all of those children actually need to be hospitalized and treated, some often in intensive care. They do very well if they get the right treatment, for sure, but it's not but it has been very scary for the families that have had that. So while children are sort of as a population much less affected by COVID than adults, and certainly much less than elderly people, they're not been unaffected. In addition to that, we do think that children play a role too, as far as like getting rid of what we really want to do. We want to end up in a situation where we have less of this COVID virus around us, and having children vaccinated so that they're can't spread it to each other in school, so they can't spread it to their adult caregivers, so they can't spread it to their grandparents, certainly is an important aspect as well. Although I would argue that protecting the children for their own sake is also important. And then this important question, what about the youngest children, the ones that we can't vaccinate? Even if I'm pro-vaccination, I can't vaccinate somebody currently that's going to be less than 5 years of age. So what can we do to protect them? Well, we should do the things. Then we have to go back to a little bit to the things that we sort of did in the beginning of the pandemic. We have to think about, are the people around this child vaccinated? So that, can we create a bubble with vaccinated people around the child? Can we make sure that we're not in indoor places with people that we don't know their vaccination status, that unknown to us? So instead, spend time so if it's big group activities, let's spend time outdoors. Sort of try to at least be able to keep distance from people that we either don't know their vaccination status or we know that they're unvaccinated. And then, of course, the other sort of healthy habits important to any young child, sort of so hand hygiene in this case would be really important, and masking for people who are unvaccinated as well. Next slide, please. So this is another sort of timely topic because it's October, and so people have asked about, should I get the flu shot this year? Really, last year I barely saw any flu, so why do I really need to get this? And the answer is to get the flu shots. Last year, because of all the masking we did and the social distancing, we hardly saw any flu, and that was sort of true across the world. So now we're entering a winter season where it's a big question sign. We don't know if the fact that people didn't get exposed to flu last year means that their immunity is going to be less good this year and maybe are going to be more likely to get severe flu disease. So that's an unknown to us. We also know that the flu shots are safe and that they are effective to prevent really severe disease from flu. It's not always, the flu shots are really, every year they develop, they sort of are, the people working on putting it together, they do like they try to forecast what type of flu strains is going to be in the community that particular year. So it's always a little bit of educated guess to put the flu shot together, and that's done for our whole population. But we do know that the flu shots, they are very effective. Sometimes you can get the flu even if you got the flu shot, but you rarely ever, even if you get the flu shot, you're very protected from sort of hospitalization or bad outcomes from the flu. So the recommendation is absolutely to get the flu shot. This year is a big unknown if we're going to have a bad flu season or not, and we don't know, so I would recommend to get it. And yes, you can get it at the same time as the COVID shot. In fact, if you go to the track, Speedway right now, to get COVID shot, they are asking routinely when you drive up there whether you want to have your flu shot at the same time. So you can get both of them at the same time. Next slide, please. I wanted to just briefly also just touch on the holiday recommendations, and these are based on the CDC recommendations for this season. As you know, I think we're all sort of missing spending time with loved ones and family, and you know, how are we supposed to tackle that this year? So so again, of course, the CDC and the, I would say, the doctor community around you are really recommending to get everybody and yourself vaccinated. That's going to be a very good protection for spending time together for the holidays. But if you are in a situation where you don't know and you're going to spend time indoors, so the recommendation is to wear the masks if you're in a public indoor setting, if you're not fully vaccinated, and even if you are fully vaccinated, you should certainly wear a mask if the spread of the virus is high. And outdoors is definitely safe, as I said previously, is a safer space to be than indoors. So if there's a way to do the activity outdoors, which can be harder in the wintertime, obviously, but that's the recommendation. Avoid crowded, poorly ventilated spaces. And this is maybe the most important thing of all. If you're sick and have symptoms, don't push it, don't host that gathering with your parents or grandparents and loved ones, because avoid being that sort of that event where somebody got sick from COVID. It's not worth it. Pay attention to your symptoms and have maybe alternative plans. What are we going to do if somebody gets sick? Think through that, I think, is the recommendation. And continue to get tested for a symptom. COVID-19 is here still, and it's not going to be completely gone by the holiday, even if the curves go down. So the recommendation is still to get tested if somebody has symptoms. And the CDC also recommends to delay travel until you're fully vaccinated, if that's in your plans to travel. They also actually have pretty good recommendations about how to safely travel if you do need to travel. So I put in the link there just to sort of check out the recommendations around holiday celebrations. And I think that may have been my last slide, right? So happy to take questions if there's any of those. And again, thank you so much for the opportunity to talk through those questions.
Yeah, I think, Dr. Fanel, the only question that I would throw out there for maybe you to respond to at this point, kind of given time, is there was a question about, you know, why aren't we sharing more information about natural immunity and the benefits of that in the conversation regarding combating COVID?
Thank you for that question. I actually think that's a great question, and I would say that I agree that we haven't necessarily had a fully informed discussion about that. There is immunity from natural, it sounds like, from having an infection. There is immunity coming from that. Again, as I said, we're learning now that immunity from having infection is much more unpredictable, depending on how severely ill you were or what symptoms you had, and potentially depending who you are as well. That immunity difference from one person to another. So you may be somebody with good natural immunity, but you may also not be. Versus what we know from the vaccines is that it's much more sort of stable, reliable. We know if 10 people with the vaccine got the vaccine, we know what their immunity levels are going to be. That's much more harder to predict with natural immunity. But I agree with the question. If the question, say, is sort of, we don't seem to talk about it at all, I would agree that yes, there's immunity coming from that infection. Doesn't look like it's as good as having the vaccines, though. We do know that having infection followed by vaccines is actually, for some people, turning into be incredibly powerful immunity. So that may be like sort of the golden ticket to longer term immunity. So hopefully that answered that question.
Yes, great. That does. Thank you so much. And thank you for spending some time with us this afternoon and giving us some updated information. I think that we all could benefit from just keeping up to date and up to speed on what's happening and what we're seeing as far as vaccinations and the trend data. So thank you so much for your time this afternoon.
Thank you.
All right, everybody, another reminder for those of you who joined during Dr. Fanel's presentation, if you haven't signed in to today's meeting, we want to make sure you get your certificate of attendance. You can, in the chat, in the Q&A box, click on the link and complete the form and submit it, and we can ensure that you get your certificate of attendance for being with us today. Just a reminder for folks regarding the federal public health emergency that the federal government renewed the PHE on October 18th. And so those Appendix K flexibilities will remain active again through the federal public health emergency. And we have an additional 6 months of approval post the public health emergency, largely for us to give ourselves time to transition away from the Appendix K flexibilities once that federal public health emergency ends. So those will be things that we continue to monitor as far as the public health emergency flexibilities. With that, I would say we expect, just based on conversations happening at the federal level, we expect to kind of see the federal public health emergency to last through the remainder of 2021. And so we'll update everyone if that changes. We also expect that when and if the federal public health emergency does sunset or end, that states would get at least a 60-day notice letting us know that that was coming. So we'll have a window of time where we can get some preliminary information or be informed about what that looks like when it happens so that we can be adequately prepared. A brief update related to the case management innovation. As many of you know, we have in October announced selected awarded case management entities through our 1915B4 that we are working to implement in 2022. We are in the transition process currently and working with individuals and families to who are affected and maybe are currently working with a case management company who is not selected to choose a new case management company, hopefully by December the 14th, so that they can get their new case management company chosen and be onboarded for our implementation in January. I would say we have updated FAQs on the Case Management Innovation website, and we also have virtual and in-person meet and greet opportunities scheduled. We've sent out some announcements about that. We have our first one actually happening this evening in Lafayette, so we are hoping to have a good turnout, and it's an opportunity for individuals and families to meet and greet those 6 awarded case management companies directly and ask some questions, connect with them, learn about their companies and what their options are, and get some additional information in those meet and greet opportunities. And we will continue those virtually and in person throughout largely the month of November, and we'll also have some additional virtual opportunities in early December. We've had several updates and questions related to provider claims resubmission. So as you all may recall, this past year we implemented a 14% rate increase for specific services on the CIH and the FSW. With that 14% rate increase for the affected services, providers were required to submit to us their provider rate implementation plans, and we had to have those plans in order for providers to be compliant with what was presented as requirements in the budget bill to access that 14%. So providers were required to submit implementation plans to us. At that point, we were also looking at reprocessing provider claims back to July 1 when the effective date of that 14% rate increase. What we saw is that we have some dynamics with those claims that we did not anticipate. So we have providers who do have approved plans with us. The vast majority who were needing to submit those did so. However, within their claims set of affected services and affected claims, some of those claims have been previously submitted for the higher rate. Some of those claims were submitted with the previous rate prior to the 14%, and some of them were actually submitted with a different rate. So when Gainwell pursues, or Indiana Medicaid pursues mass reprocessing of claims, they can only do that under certain circumstances, and based on the variety of circumstances in these claims, we are not having them mass reprocess these claims. So providers who submitted a plan to us can resubmit their claims for reprocessing at any time. At this time, we are directing providers who reach out to us about that to go ahead and resubmit their eligible claims. We're going to be submitting an announcement or notification about this as well, probably within the coming week, but we just wanted to make you all aware that that was the dynamic with our exploration of trying to reprocess those claims in order to just be of assistance to providers to get remittance of that 14%. But the further we look and research that, the less feasible it is for us to actually mass reprocess those without running into additional issues. So at this point, we are telling providers to go ahead and reprocess those claims. So with that, just a final reminder, if you guys are still on and you haven't signed in yet, please go ahead and click the link and complete the form in the Q&A box and submit that to us so that we have record of your attendance, so that you get a certificate of attendance today. And with that, we appreciate, just know that we're running up to the 4 o'clock hour. Just appreciate everybody's attention today and participation and listening to Dr. Fanel's updates on COVID-19. And we'll look to seeing everybody next month. Thanks, everybody.